Have you ever felt like you've shrunk? Or the room around you has suddenly grown enormous? Or maybe objects seem farther away or closer than they really are? This might sound like a trip down the rabbit hole, but it's a real neurological condition called Alice in Wonderland syndrome, or AIWS. Today, we're going to explore this fascinating and rare condition. Don't worry, it's not as scary as it sounds, and for most people, it's temporary. Let's unravel the mystery of AIWS together. So, what exactly is Alice in Wonderland syndrome? Named by psychiatrist John Todd in 1955, it's a condition that distorts your perception. It messes with how your brain processes what you see and how you sense your own body. This can make things look or feel larger, smaller, closer, or farther away than they actually are. Just like in Lewis Carroll's famous story, your perception of reality gets a little peculiar. Who does this happen to? AIWS is most commonly seen in children and teenagers. Some studies suggest that up to 30% of adolescents might experience a brief episode. However, it's considered very rare overall. In fact, fewer than 200 cases were documented between 1955 and 2016. One reason for this is that the episodes are often very short, and many of the causes are temporary too. Plus, there aren't standardized diagnostic criteria, which means it's likely underdiagnosed. There are 3 main ways AIWs can manifest. The most common type, making up about 75% of cases, involves visual disturbances. This is when the world around you looks distorted. For example, a chair might seem tiny. That's called micropsia. Or it could look gigantic. That's macropsia. Straight lines might appear wavy, and objects could seem to be rushing toward you or receding into the distance. The second type affects your self-perception. This is where you might feel that a part of your body, like your hand, has become huge, or your entire body has shrunk. This can also come with feelings of depersonalization, where you feel disconnected from your own thoughts and body, like you're watching a movie of your life. Or derealization, where the world around you feels unreal. Some people even report feeling as if their body is split in two. The third type is a combination of both visual and self-perception symptoms. Imagine feeling like you're shrinking while the room around you expands. It can be a disorienting experience, to say the least. Your sense of time can also get warped, feeling like it's speeding up or slowing right down. So what causes this strange phenomenon? It's not one single thing. One of the most common triggers is migraines, especially the aura phase that can precede the headache. Infections are another major cause, particularly in children. Viruses like Epstein-Barr, which causes mono, the flu, or even the chickenpox virus can trigger AIWS. Other potential causes include epilepsy, certain medications, and in very rare instances, more serious conditions like brain tumors or strokes. This is why it's so important to see a doctor if you experience these symptoms. It's not something to self-diagnose. Speaking of diagnosis, how do doctors figure out if it's AIWS? There isn't a specific test for the syndrome itself. A doctor will typically start by asking about your symptoms and doing a neurological exam. They'll want to rule out other conditions. This might involve tests like an MRI or CT scan to look at your brain structure, an EEG to check for seizure activity, or even a spinal tap to test for infection. Now for the good news, how is it treated? There's no cure for AIWS itself, but that's because you don't treat the syndrome. You treat the underlying cause. If it's caused by a migraine, managing your migraines can stop the episodes. If it's from an infection, the symptoms will usually disappear as you recover. Because most causes are temporary, the episodes of AIWS usually are too, often lasting just minutes or hours. While AIWS itself isn't dangerous, the symptoms can be alarming. And because it can be a sign of something more serious, you should never ignore it. If you suddenly experience these perceptual distortions for the first time, especially with other symptoms like a fever, severe headache, confusion, or trouble speaking, seek medical attention right away. It's interesting to think about the name. Lewis Carroll, the author of Alice's Adventures in Wonderland, suffered from severe migraines. Some historians and medical experts speculate that his own experiences with migraine auras might have inspired the bizarre size-changing scenes in his book. We can't know for sure, but it's a compelling thought that these strange symptoms might have been immortalized in classic literature. So, to recap, Alice in Wonderland syndrome is a rare perceptual disorder that can make you or the world around you seem to change size and shape. It's usually temporary and caused by other conditions like migraines or infections. While the experience can be unsettling, the outlook is generally very good once the underlying cause is identified and treated. It's a reminder of just how complex and mysterious our brains are, and how our perception of reality is a delicate construction. If you've ever experienced anything like this, we'd be interested to hear about it in the comments below. And if this has happened to you, remember you're not alone, and help is available. Thank you so much for joining me on this journey down the rabbit hole. If you found this video interesting and learned something new, please give it a thumbs up, and don't forget to subscribe and hit the notification bell for more deep dives into the fascinating world of our minds. Stay curious, and see you in the next video.